When verruca vulgaris doesn't respond to standard treatment, topical cidofovir might help. Dr. Jim Treat explained how he uses topical cidofovir at the Women's and Pediatric Dermatology Seminar.
When I'm faced with severely recalcitrant warts that have failed multiple destructive and topical therapies, one of the things that is an option out there that's completely off-label but has been reported multiple times is topical cidofovir. We usually start with 1% topical cidofovir compounded in either petrolatum or a cream-based moisturizer. It is extremely expensive. It's something that even with insurance coverage usually costs several $100s, so again, not going to be your first-line agent. We usually do not occlude it because I worry that if you occlude it, you're going to end up with more absorption in the body and more potential kidney problems. And then if 1% fails, people have used up to 3%, and I've used 3% in a couple of patients and had that be successful. But those patients I would more closely monitor to make sure that there's not either tremendous irritation or any kidney disease that's happening while you're on the therapy. In my own practice, I've had most of the patients respond at least partially, and I've had multiple patients have complete responses, but I only use it for severely recalcitrant warts. So in patients who are immunosuppressed, most of the therapies that we use require the immune system to have some activity. So for instance, again, off-label injecting Candida antigen or doing liquid nitrogen, while it does kill some of the virus, it does require the immune system to help you to create inflammation. If you have someone who's immunosuppressed or has a congenital immunodeficiency, having a therapeutic option that directly kills virus, which is topical cidofovir, is nice to have in the armamentarium. Again, it's something that you wouldn't use first line or second line or third line, but you can use if everything else has failed and has good data. You do worry about it being absorbed because it can cause severe kidney toxicity if it is absorbed, and that's why we're putting it on hands and feet and going slowly with it. And some will check creatinines or urinalysis, and I have done that. I've never found them to be abnormal on therapy. Make sure that the person starts with baseline normal kidney functions before using it. And if they have a known kidney disorder, I probably wouldn't use it, or at the very least, I would talk to the kidney doctor who was taking care of the patient. And I would also talk to the doctor who's taking care of the patient for their immunosuppression and make sure that they didn't have any concerns with it, and make sure that there were no other contraindications. If someone failed cidofovir, I would still try to use other things, but it's a combination of lots of off-label things being used simultaneously. So you might use off-label oral cimetidine along with cryotherapy, along with a topical salicylic acid, and kind of do everything at once. And really, a lot of wart treatment is compliance and seeing people regularly to not allow the warts to regrow in between therapies.